Hello, everyone. This is Health Reframed, where we simplify the science of health, break down complex medical concepts, and explore how we can reframe our approach to wellness, focusing on prevention, education, and systemic improvements that empower people to live healthier lives. My name is Jack Snyder. I am a prospective doctor with a degree in biomedical sciences with a concentration in anatomy and physiology. I am also an EMT and have worked in healthcare for about 4 years now. Today, our topic is hypertension, more commonly known as high blood pressure. This chronic condition affects about half of adults in the United States and is associated with many other chronic illnesses. Today, we talk about what hypertension is, how drugs that lower blood pressure work, what lifestyle changes you can incorporate to manage high blood pressure, and how we think about health in a cultural context, specifically with regards to high blood pressure. Whether you are looking for better explanations of hypertension and its treatments, or are just curious about how to prevent or improve your hypertension, you're in the right place. Anyways, without further ado, let's get right into it. So to start, we are going to break down the science. So as I stated before, hypertension is literally high blood pressure. Many of you may know I enjoy breaking these big Latin words down, and it's the same here. So the word can be broken down into hyper for more or high, and tension for pressure. So it literally means high pressure. However, this is a measurement that many people really don't understand. Blood pressure, as the name suggests, is the amount of pressure that your blood is exerting on the walls of your arteries specifically. You can think about it like filling a balloon with water. As you fill it, the balloon will have more pressure on it, and in your body, this pressure on your arteries can cause problems over time, similar to how if you overfill a balloon, it will pop. Arteries are the blood vessels that carry blood away from your heart, and veins are blood vessels that carry blood to the heart. But the amount of pressure in the veins is a lot less than the arteries, so the blood pressure measurements that we take are on the arteries. Many, if not all of you, will have had your blood pressure taken at some point. Blood pressure is given as a fraction with two numbers. You have the systolic blood pressure on top and the diastolic blood pressure on bottom. You may have heard your blood pressure being said by the healthcare provider as something like 127/80. The 127 is the systolic blood pressure, and the 80 would be the diastolic blood pressure. The systolic pressure is the pressure that produces, the systolic blood pressure is the pressure produced by the heart when it pumps blood out to the body. And the diastolic pressure is the pressure that the arteries have at rest, when the blood is actively not being pumped through them. Both of these numbers are important in reflecting heart health. However, the systolic blood pressure, the one on top, is more often the point of interest as it is more correlated with strokes and heart disease. The American Heart Association gives guidelines for normal and abnormal blood pressure values for both systolic and diastolic pressures. The standard normal blood pressure is defined as 120/80. From here, if the systolic is between 120 and 129, this is called elevated blood pressure. If the systolic gets up to between 130 and 139, and the diastolic between 80 and 89, this is stage 1 hypertension. And if the systolic reaches above 140 and the diastolic above 90, this is stage 2 hypertension. And finally, if your blood pressure is above 180/120, this is called a hypertensive crisis, and it necessitates emergency medical help. So if this is you, you should probably seek some medical attention right away. Various factors can raise blood pressure, and this leads to hypertension. The Mayo Clinic lists advancing age, race, family history, obesity, lack of exercise, tobacco use, too much salt, too much alcohol, stress, and certain chronic conditions as factors that contribute to hypertension. Some of these are inherent and some are not. We will delve much more into how you can work with your own personal biology and develop a mindset that will help you prevent hypertension or reduce it if you currently have it. So now that we have an idea of what hypertension is, why do we actually care about it in the first place? Well, Unaddressed hypertension can lead to heart attacks, strokes, heart failure, sexual dysfunction, kidney disease, and vision loss, to name a few. So it's a pretty big deal. And even a small rise in systolic blood pressure, say 20 points, is enough to double the risk of heart disease and stroke. So even small changes can make quite a big difference in health outcomes here. This certainly sounds scary, especially for something that does not seem a very big deal at the moment. A lot of times you don't feel many active effects of high blood pressure unless it gets really, really high, of course. However, I bring this up so that you can understand the importance of managing your health and to prevent hypertension, as it can lead to so many negative things. Understanding this can help give reason and purpose for adapting lifestyle changes as well as seeking treatment. Anyways, so how does hypertension even cause all of these problems? Well, back to our balloon analogy from earlier. Imagine you blow up a balloon again and again. You blow it up, you deflate it. You blow it up, you deflate it. You can imagine that this would slowly stretch out the walls and possibly even damage the balloon. And this is exactly what happens in your arteries as they are continually stretched. They incur tiny tears, actually, and get repaired over time. However, these tears can accumulate fats and cholesterol inside of them, which can form plaque, which effectively narrows the diameter of the blood vessel. A good analogy here would be a heavy trafficked road. Over time, the road will have wear and tear, and it will form many cracks. And in the road, these cracks are filled with tar, but your body will fill them with fats and cholesterol, forming plaque. This plaque, like I said, can narrow the diameter of the artery over time, and this narrowing makes it more difficult for blood to flow through the artery. This can lead to serious conditions like heart attacks or strokes, which are huge deals. So this gives a bird's-eye view of how hypertension can lead to more serious problems. Hypertension in and of itself is pretty simple to understand, but I think what can be far more difficult is implementing lifestyle changes to improve one's own health so as to not be hypertensive anymore. In my opinion, this is an important point because although we have many, many hypertensive medications, these often only address the symptoms without focusing on the root problem, which is often lifestyle related. A quick note here though, many people, not many, but around 5% of people who have hypertension have it because of genetic or underlying conditions. And in this case, medications, in my opinion, are far more warranted. And this is one reason why, with any of the stuff we're talking about today, it is important to consult a healthcare professional to see what the best course of treatment is for you. Regardless, I think these medications can be helpful, even for people who don't have hypertension caused by some underlying cause or disease or genetics, because I think they can be used to help you manage blood pressure as you incorporate the lifestyle changes. But now that we've covered the basic science, I'm going to go over some of the hypertensive medications, as well as how they work, and how you can incorporate simple changes in your life to better manage blood pressure and perhaps cease to need medication at all. To start, I'm going to discuss hypertensive medications because around 62 Americans are on them, and that is a large portion of the population. And this section will be rather dense, I will forewarn you, but I have condensed it down. I've taken the very complicated science and pharmacology of these drugs and tried to put it in a way that I think a lot of people, most people, will be able to understand. And because of this, I think you will have a better understanding of them, regardless if you take them or not. Personally, I find that if I'm on a medication and I know how it works, I feel a lot more comfortable taking it. Before we talk about how these medications work, I am going to quickly bring up how your body can lower blood pressure. It can do this through the so-called autonomic nervous system, the renin-angiotensin-aldosterone, or RAS system, the kidneys, by reducing water in the blood, and the actual blood vessels themselves. So this sounds very complicated, but I will go through each one of these systems one by one with each medication class that they're associated with. As many of you know, your body has a nervous system. However, to understand how drugs that target the nervous system work, we need to break down the nervous system into a couple of different parts. You have the part that you normally think of, and this is called the somatic nervous system. This division is responsible for controlling muscles and such. So if you reach for a glass of water or do jumping jacks or do any conscious movement at all, this is going to be your somatic motor system, your somatic nervous system at work. The other division is the autonomic nervous system, or the ANS. As the name implies, this system controls the automatic functions of the body. Think about your heart. It beats without you having to think about it. It happens totally automatically. It probably wouldn't be very great if you had to think about your heart and cause it to beat for every single beat. Same with your breathing and your digestive system and all of the automatic functions in your body. The autonomic nervous system handles all of this for you without you even thinking about it. And the autonomic nervous system itself can be divided. It has two divisions. There is the sympathetic nervous system, commonly known as the fight or flight system, and the parasympathetic nervous system, which is referred to often as the rest and digest system. Many of you will have heard of these, and they're both vital for maintaining function in the body. They serve almost opposite roles. I like to think of it as if you have two opposing forces with each other, pushing against one another, the degree of accuracy and precision that they can dial certain things into is a lot higher. So instead of just having the sympathetic nervous system, which does fight or flight, you have the parasympathetic as well. So one can't take over too much because the other has a check on it. Kind of checks and balances, if you want to think of it like that. Today, we are going to focus mainly on the sympathetic nervous system because certain parts of it control the heart. And sympathetic innervation to the heart causes it to pump harder and faster. This is a very important concept, so keep it in mind as we keep talking through these drugs. So this brings us to our first class of antihypertensive medications, antihypertensive called as such because they move against hypertension, they reduce hypertension, and lower your blood pressure. The first class we'll talk about today are called beta blockers. Many of you will have heard of these, and common beta blockers are metoprolol or propranolol. They all end in LOL. If this helps, these drug medications are awful. I understand. I don't know how to spell them 90% of the time myself, but often they end in a similar way, and you'll see this theme with the drugs we talk about today. But the beta blockers all end in LOL. So in a word, these drugs reduce the force that your heart pumps with, which in turn lowers the pressure on your blood vessels. And if you think about that, that makes sense. If your heart is squeezing blood into the vessels and it squeezes really hard, the pressure in the vessels is going to be a lot higher than if the heart squeezes with less force. But how exactly does this work? How do we lower the degree to which your heart pumps and the strength it pumps with? Well, these drugs, as the name implies, block the beta receptors on the heart. But what exactly does this mean? So, as I discussed before, the autonomic nervous system, specifically the sympathetic branch, controls the heart by making it beat faster and harder. And it does this by releasing neurotransmitters at the end of the nerves onto receptors in the heart. The nervous system, the autonomic nervous system, has nerves projecting out to different organs, and they land on the target organs, and they release chemicals, these neurotransmitters, that elicit an effect. And the nervous system tells the heart what to do with these chemicals. And how these drugs work is by taking up the spot that the normal neurotransmitter would bind to. So the nerve will release the neurotransmitter, and the neurotransmitter has to bind to a receptor on the heart for the action or the effect to be elicited. But the beta blockers will block this receptor on the heart, and this way the neurotransmitter cannot bind, and as a result, the effect is reduced. So now that the nervous system can't tell the heart to beat with as much force, this lowers blood pressure. The next class of drugs are ones that act on the renin-aldosterone-angiotensin system. Now, this is a big name, but I will break it down, and I think it's pretty straightforward once you understand how it works. But before we do that, and before we get into the drugs, I'm going to explain this system. So, as many of you know, your body produces hormones, and hormones cause different effects in the body. Hormones are chemicals in your blood. They are produced by glands like your thyroid gland or your adrenal glands, and they are released into the blood, and they cause a certain effect. It's almost like the nervous system, but in the blood. You can almost think of hormones like slow-acting neurotransmitters. And today, the hormone that we will be talking about is called angiotensin II. This hormone causes many, 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 many things to happen in the body. It has so many effects, but the two that we will be focusing on today are that it causes fluid retention and it constricts blood vessels. In other words, it actually raises blood pressure. So when angiotensin II is released in your body, you retain fluid, you don't pee as much. That fluid goes into your blood, which causes more pressure as you have more water in the blood pushing out against the arteries, and it constricts the blood vessel. So if you make the blood vessel smaller, the pressure goes up. Think about back to the balloon. If you squeeze the balloon, or if you squeeze a hose, for instance, the pressure inside will go up. So this hormone is our target because if you can block it, you can release more water from the urine and your blood vessels won't constrict as much, both of which will end up lowering the blood pressure. In other words, angiotensin raises blood pressure, so if you block it, you'll lower blood pressure. Like before, we mentioned receptors that neurotransmitters act on. Hormones are similar. They also have receptors that they act on, and angiotensin II is no different. So if you can block the receptors that angiotensin II binds to, you can reduce its effects and lower blood pressure. Drugs that do this are called angiotensin receptor antagonists, and a common drug in this class is called losartan. Losartan is a very common antihypertensive drug, and it blocks angiotensin from its receptors, much like the beta blockers did for the sympathetic receptors. No angiotensin II on the receptors, no effect, and blood pressure goes down. Another way to target angiotensin II is by targeting the process that actually creates it. So with hormones and really anything in the body has to have a process to create it because you give your body food, and this food is broken down into very, very simple chemicals, amino acids, proteins, fats, carbohydrates, and your body has to turn that into really, really complicated things inside of your cells and different organs to do different tasks. Hormones are no different. Hormones must be created, and there are very complicated processes that do this. But today, all that we need to know is that angiotensin II is made from angiotensin I. So angiotensin I is made first, and then it's converted into angiotensin II. And you might be wondering, well, why do we need angiotensin II if we already have angiotensin I? And the reason is angiotensin I doesn't have many effects in the body. Angiotensin II has the majority of the effects, and it must be converted into angiotensin II. So we actually have drugs that block this conversion between angiotensin I and angiotensin II, and the name is angiotensin converting enzyme inhibitors. Now, this is a big name, but let's break it down. So you have angiotensin converting, so it's converting angiotensin, and it's an enzyme. So it's the enzyme that converts angiotensin I into angiotensin II, and the drugs inhibit this enzyme. So if we can inhibit the enzyme, or an enzyme is another molecule that your body uses to aid in chemical reactions. So if we can inhibit this enzyme, then angiotensin II won't be created. These drugs, many of you have heard of them, are often abbreviated as ACE inhibitors. And some of them are, or the most common one I should say, is lisinopril. These drugs all end in pril, similar to earlier with the beta blockers that ended in lol. These all end in pril. So if you're on it, you'll know it because it ends in pril. So in effect, to sum it up, they stop angiotensin II from ever being formed, which means it cannot have its effects, and blood pressure goes down. All this talk of angiotensin, hormones, and such can be rather confusing, but we can sum it up like this. The hormone angiotensin II causes blood pressure to go up, so if we can stop it from working or stop it from being made, blood pressure goes down. The next group of drugs are called diuretics, and these drugs cause you to pee more, pretty much. As stated before, your blood is made up mostly of water, so if you can reduce the amount of water in your blood, the pressure goes down, and these drugs do just that. There are many kinds of diuretics, but the one we will focus on here is the most common one, and it's hydrochlorothiazide. Big name, and before we get into how it works, we're going to talk about kind of how the kidneys filter your blood. So your kidneys do indeed filter your blood, and they keep what your body needs, and they get rid of what it does not need in the form of urine. And one of the things your body well, it needs it, but it also has to get rid of it, is water, as your body inevitably has to get rid of water. Think of all of the water you've ever drank in your whole life, if you never got rid of it. That would be a problem, right? You have to get rid of some water. And this removal of water happens mainly in your kidneys, a little bit in your intestines, but mainly in your kidneys. And they do this not by moving water, but by moving salt. So the blood goes into your kidneys, and the things that your body doesn't want to keep is filtered out and turned into urine. But to get the water into your urine, it actually moves salt into the urine. Salt, or sodium chloride, contains the ions sodium and chlorine, or chloride, excuse me. These ions dissolve in water. Think about dissolving salt into water when making pasta. But we don't need to get into the deep chemistry here, but the basic concept is this: water follows salt. So if you can move more salt into the urine side of things, out of the blood, the water will follow. Hydroxychlorothiazide does just this. It causes more salt to be excreted into the urine, which causes water from the blood to follow. Less water in the blood, lower blood pressure. Finally, we will talk about calcium channel blockers. A common calcium channel blocker is called amlodipine. These drugs end in pine, and as before, these drugs rely on a chemical and a receptor that the chemical binds to. The chemical in this case is the ion calcium, and the receptor are calcium channels, which are little holes or pores on the cells that only calcium can move into. So it lets calcium in and nothing else. But before we describe how these drugs work, we do indeed need to talk about muscles. Muscles, like your biceps or quads, rely on calcium to contract or move. Calcium is actually the final effector that causes your muscles to move. You also have muscles in your arteries, though. These muscles are called smooth muscles and can either increase or decrease the diameter of the artery. A smaller diameter will squeeze the artery and contract, and it'll increase pressure. Think about, once again, the balloon filled with water. And a larger diameter vessel will reduce the blood pressure. It'll relax, and it won't be squeezing quite as hard on the blood. So our goal here is to increase the diameter of the blood vessels because that lowers blood pressure. And we can do this by causing the muscles in your arteries to relax. Like your biceps, the muscles in your arteries contract with calcium. So if we can stop calcium from getting into the muscles, then they will relax. And this is precisely how calcium channel blockers work. So they block the channel that calcium ions use to get into the muscle cells. Like I said, the channel is like a hole in the cell that only lets calcium through. So if you plug the hole effectively, no calcium goes in and the muscle relaxes. So to summarize all of that, calcium causes your arteries to contract, which increases blood pressure. Calcium channel blockers make it so that calcium does not get into the muscle cells, so they relax. So I know that's a lot, but let's kind of summarize these all together now. Beta blockers cause your heart to beat with less force. Losartan and ACE inhibitors stop either the production or effect of angiotensin II. Remember, angiotensin II is a hormone that raises blood pressure, so stopping its production or the effect lowers blood pressure. Hydrochlorothiazide causes you to pee more effectively, reducing the amount of water in your blood, and calcium channel blockers cause your arteries to relax, reducing the pressure. So as far as the efficacy of these drugs, they're all reasonably effective, causing between a 10 and 15 point drop in systolic blood pressure. This can be very helpful for many people who have trouble managing hypertension, as well as the people who have underlying disease states or genetics that cause them to be hypertensive. And I also think that they can be very beneficial when starting the process of implementing lifestyle changes. Say you go to the doctor, they say, hey, you have hypertension. We need to have some lifestyle changes. We need to have a discussion about this. And in the meantime, we can get on this medication, which can start to lower your blood pressure so it's not dangerous now. And over time, as you improve your lifestyle choices, we can slowly remove the medication and the lifestyle choices will continue to keep your blood pressure low, something like that. However, because I think these drugs don't go to the root cause of the issue, namely the lifestyle choices, they merely address the symptom. So for this reason, I believe that addressing the root cause is a lot more prevalent to our discussion. Like I said, I think these drugs have their place, but at the end of the day, if you want to quote unquote cure the hypertension, you do need to affect the root causes, perhaps in concert with the drugs. This way, you fix the problem for good, and you reap all the other benefits that a healthier lifestyle gives. And this segues us perfectly into a discussion of just what that lifestyle might look like to lower your blood pressure. Now that we've talked about the traditional ways that Western medicine handles blood pressure, let's take a look at changes you can implement yourself. Though these are not necessarily as simple as taking a pill every day, enacting change in your life towards a goal is something that has benefits much greater than just reaching the goal. So why consider lifestyle changes in the first place, you might ask, if we have pills that seem to fix the problem right away? This is indeed a very good question, and I will answer it twofold. To start, like I mentioned, hypertensive medications often don't address the underlying cause of hypertension, which are often lifestyle-related factors. However, if you can implement lifestyle changes, you do indeed address these underlying causes. And as I've brought up time and time again, one caveat here is that something around 5% of people who have hypertension have it due to genetic factors or other conditions like kidney disease or thyroid disease, which, again, I'll note, always consult a healthcare professional with these sort of things so that you can find the best course for yourself. These conditions are often identifiable with tests and can be treated as such. This is one reason to consult a healthcare provider, again, harping on this because they can do these tests and they can give you individual advice. I'm giving very broad advice today, but if you go to a healthcare provider, you can get that individual advice. Furthermore, along with this, lifestyle changes do work best in more mild cases of hypertension, which is something to consider. If you're only a couple points too high, lifestyle changes can get you those points back relatively easily. But if you're 30, 40, 50 points too high consistently, lifestyle changes are going to have a tougher time to bring you down, and medications might be important to implement in that case as well. So the other reason to implement lifestyle changes is one that is the heart of this podcast's ethos, if you will. Taking control over your life gives you the power to be the best person you can. And taking control over your hypertension, for instance, gives you the knowledge of how to take over control of other parts of your life. One of my main goals is to give all of you the tools to take control of your health, something that can teach you how to take control over other areas. If you take control of your hypertension, you can perhaps take control of other things that may need your attention in your life. But because health is often necessary to achieve other things in life, I think it's important to know how to manage your health just beyond taking the pills. Anyways, without further ado, let's get into some actionable protocols for hypertension. Perhaps the most well-known lifestyle change for hypertension is changing your diet. The topic of diet is something that is quite vast, so today we'll take more of a bird's eye view. I probably do a whole other episode on diet, multiple episodes at some point. Diet is very intricate and complicated, but we'll take a bird's eye view today. However, I think it's important to talk about why diet is so often talked about. Diet is literally what goes into the body. It can often be hard to conceptualize, but it is very much the case that you are what you eat, meaning that what goes in is of utmost importance. Consider a high-performance sports car, a Lamborghini or a Maserati, right? If you put low-grade gasoline into it, put cheap oil in, you don't take it to the shop that often, it's like it'll run, right? But you won't be taking it to the maximum potential. It won't be running very well. And it certainly won't be running as well as if you put in high-octane gas and top-of-the-line oil and you consistently take it to the mechanic to make sure everything's okay. It doesn't need new belts or gaskets or anything like that. And your body is very much the same. It can survive and perform if you put lower-quality food into it, but it'll perform a lot better, and more importantly, you will feel a lot better if you put better food in. Furthermore, eating quality food not only improves, a paper by Lanchi and Ramsey states that dietary patterns high in processed foods are strongly correlated with an increased risk of developing depression, mild cognitive impairment, and ADHD. Point is, there is a lot more at stake than just improvement of hypertension. So what would the human equivalent of high-octane gas in top-shelf oil be? Multiple countries, including the International Society of Hypertension, recommend certain diet changes shown very clearly to improve blood pressure. They found that diets rich in fruits, vegetables, low-fat dairy, whole grains, nuts, poultry, and fish improve hypertension. Much of what a diet like this does is help you reach a healthier weight, if that is a factor. It also provides your body with a good balance of nutrients. You're able to consume plenty of vitamins and minerals without consuming too many calories or other nutrients. A lot of these foods are low calorie density foods, meaning that they don't have a lot of calories for their weight. M&Ms have a lot of calories for their weight. A stalk of celery does not have a lot of calories for its weight. However, one of the biggest challenges to overcome, especially in America, is shifting these foods that you eat. As many of us know, processed foods are all around us, and it can be quite difficult to make healthy choices with foods when these are our common options. For this reason, I think it might be more instructive to look at the things to avoid. I know, at least for myself, it can often be it can be easier to remove something than to start doing something totally new. That said, it can still be difficult to remove something, but I think it just can be a little easier, if not easier to see, perhaps. Recommendations on things to avoid to improve hypertension include sodium, high amounts of red meat, processed foods, and alcohol. For sodium, it is recommended to aim below 2,000 and ideally less than 1,000 milligrams per day. And for alcohol, it is recommended to be less than 2 standard drinks per day for men and less than 1 per day for women. These are all very good guidelines backed by much research, but the issue of actually achieving them can still be difficult. Indeed, if your diet consists of a lot of processed food or alcohol or salt already, it seems like an almost insurmountable task to overcome if you want to immediately reach the recommended guidelines. So instead, I propose a bit of a different avenue. Instead of going cold turkey and totally doing a 180 on your diet, I think it's a lot more effective to slowly reduce them over time. Let me explain. So let's say you're someone who eats 3 pizzas every day for dinner and you've done it for 10 years. Now, if I asked you right now today to stop point blank, like no more pizza for dinner, you're eating a big salad and like a piece of chicken with rice every dinner, like this is what you're doing now, you might get through a day, you might get through a week, maybe a month if you're really lucky, but it's very unlikely that this change is going to be very permanent. A good example of this is people who set New Year's resolutions. Only about 10% of New Year's resolutions stick. So forming a habit is very difficult. And one of the reasons for this is because our prior habits are still there, and our prior habits are very strong indeed. Instead, you have to set small goals to slowly tweak the prior habit. So these goals may seem stupid. Like instead of eating 3 pizzas for dinner, you eat 3 pizzas minus 1 slice. Like seriously, this is the degree of improvement that we should be looking for. Because at the moment, this 1% improvement doesn't seem like much. But if you improve 1% per day, and you do this consistently, you will see incredible improvements over a month, 2 months, and within a year, you'll be a totally different person. And the part about this that is important is that making a 1% improvement every day is a whole hell of a lot easier than doing a complete 180 instantly. Now, it is unlikely that many of you eat 3 whole pizzas for dinner, but many, myself included, all have things that we know we can work on. Often it takes some introspection, asking yourself, what part of my diet is not good for me? And an answer will often spring to your head. And once you have this answer, ask yourself, okay, how can I improve this part of my diet in the smallest way possible? For instance, I don't eat as many vegetables as I probably should. So in this case, I would first identify vegetables that I actually like. I think it's important to make these changes in a way that is easiest for you, and the best way to do that is asking yourself, what do I actually like, right? So I like broccoli, for instance. So it's going to be a lot easier to implement broccoli than if I implement, I don't know, beets or something that I hate. I've actually never had beets, but I doubt I'd like them as much as broccoli. So then I would slowly incorporate that change. So I could go to the store, and next time I go to the store, I will buy some broccoli. That's it. That's my goal. I don't eat, like the goal doesn't even include eating broccoli or eat this every night with dinner. See, even though I don't necessarily eat the broccoli and like reach my goal, the act of buying the broccoli is 1% or however much more aligned with my goal of eating more vegetables. Big picture, the idea of goal setting with regards to diet or anything for that matter must rely on keeping in mind the big ideal that you're aiming towards, like the diet recommendations I've laid out earlier, and making micro adjustments towards that. If you imagine the goal as some direction you want to walk, but right now you're facing the opposite direction. You want to walk north, but right now you're faced south. You could totally do a 180 and start walking north, but it's going to be a lot harder. Well, let's say north is really uphill. Okay. North is very uphill. If you do a 180 and try to start walking north, it's going to be a lot more difficult. But if you slowly turn north, like 1% a day, like instead of walking south, you walk south like just off by 1 degree, and you do this over time, it's going to be a lot less noticeable that you're making these changes. And before you know it, you'll be walking north. And this kind of goal-setting philosophy will apply to really all the recommendations I make. Small changes, so small that they don't even seem like they're changes or getting you anywhere, are actually vital. Anyways, back to hypertension. In a similar vein as diet, weight reduction is often an important factor to tackle with lowering blood pressure. There is definitive evidence correlating obesity with hypertension. So, lowering weight will, in many cases, improve blood pressure. Weight reduction, like diet change, is not easy though, but as I stated before, it is of the utmost importance to focus on small changes. And a bonus is that if you begin to reshape your diet, weight often follows. Weight reduction is often a misunderstood beast, so I would like to make clear a couple of things here. To begin, there is quite literally only one way to lose weight. You heard that right, one way. And that way is calories in versus calories out. Your body needs a certain amount of energy per day, and this energy can come from food or fat in your body. You burn 2,000 calories in a day? Well, you need to get those 2,000 calories. And over time, if you reduce the amount of food you eat, your body will actually have to pull from the fat stores to reach that energy goal. And as it pulls from these fat stores, you lose weight. One point to note is that your body can also use muscle for energy. So if you lose weight too quickly, you will be losing muscle mass. But this idea is always at play when losing weight. And an important part of this is finding a way that works for you. Some people love the keto diet or the carnivore diet or the paleo diet. Some find it most effective to log all their calories and stay within certain strict boundaries. But at the end of the day, they all cause you to lose weight the same way. It's a calorie deficit. What is crucial is finding something you enjoy and making sure you get all the required nutrients you need every day. So if you're not getting a certain vitamin, it can be beneficial to supplement with vitamins. I take a multivitamin every day, so if you take a multivitamin every day, you don't really have to think about that as much. The idea of weight loss is another point that will require some personal reflection. Identify what you enjoy eating and what you could do without, and try to slowly reshape your eating to something that you actually enjoy. If you just love carbs, then maybe keto isn't the best for you because you probably won't stick with it since you love carbs. I find journaling about such things to be very helpful. If you can think about something like diet and weight loss and let your mind work and write while you think, you can develop ideas and goals and plans much more effectively, in my experience. Another aspect of weight loss is exercise. As mentioned before, all weight loss comes down to calories in versus calories out. So you can manipulate calories in with diet, and you can also manipulate calories out with exercise. Your body uses energy at all hours of the day, and much of that time, especially in Western culture, is rather sedentary. Sitting and laying down and sleeping doesn't burn many calories. However, incorporating more movement into your life will increase the amount of calories that you use in a day. This can be as simple as parking a little further away from the grocery store so you have to walk further, or going up the stairs instead of taking the elevator. You can, however, also incorporate dedicated exercise time. I have a whole other episode on exercise that goes way more in depth than I do here. So if you're curious about the best ways to exercise, check that episode out. However, there are some broad exercise guidelines that are good to keep in mind and to strive towards with the goal-setting behavior I laid out before. First of all, physical activity has been shown to reduce cardiovascular mortality by between 16 and 67%. Impressive numbers indeed. And a very common guideline is 150 minutes of aerobic exercise a week. This would be things like walking, cycling, or swimming. These exercises increase your heart rate and burn calories, along with improving many other systems in your body over time. High-intensity exercise is also thought to reduce blood pressure. These would be things like weight training or high-intensity interval training. As before, though, try not to be overwhelmed by these guidelines, as they seem very insurmountable at times if you live a sedentary life or aren't accustomed to exercising. However, starting out simple with the grocery store example or taking the stairs can be a very great first step. Another thing I want to harp on is walking. Walking is relatively easy to do and has phenomenal impacts on health. Going on walks during work breaks or in the mornings or evenings, it can really get the ball rolling with exercise, and it clears your mind and has all of the cardio benefits I mentioned before. But like diet, exercise must be personal. It's important to exercise in a way that you actually enjoy, because if you don't, it's not likely to be sustainable for you. So again, reflect on what physical activities you enjoy doing, or at least which ones you would enjoy more than others. This can help give you an idea of what to pursue. These are some big lifestyle changes that are important, but there are a few more to note on top of these. So potassium supplementation has been shown to reduce blood pressure, especially for people who have high salt diets. The reductions aren't huge, but they are significant enough that it might be worth buying supplements, trying them out, and seeing how well you respond. Smoking is another big factor here that affects blood pressure. The relationship isn't fully understood. Smoking and quitting smoking is a big topic though, so I will mostly leave it to that. There's some evidence that it lowers blood pressure. And what we do know for sure, though, is that smoking is the second leading cause of death worldwide. So taking steps to quit is always good advice, albeit very difficult advice. And again, probably do another episode on that. And finally, stress is another factor that's highly correlated with hypertension. Being really stressed out can cause your blood pressure to go up. And it's another episode or another topic I'll do a whole episode on just due to its complexity. But incorporating de-stressing activities in your life will likely help blood pressure if that's one of the things that raises yours. This can be things like working out, meditating, spending time with friends and family, getting good sleep, therapy, journaling, those sort of things. Stress is a very, very big issue. So if you're chronically stressed, it'll be worthwhile for more than just blood pressure to seek ways to reduce stress. And as with all of this, if you're really, really, really stressed, probably wouldn't hurt to talk to a healthcare provider. That is a lot of information, but let's break this down, let's summarize it, and go over the key takeaways. A diet like the one mentioned before has been shown to be the most effective way to treat hypertension. Such a diet can reduce blood pressure by more than double, as opposed to not adopting such a diet. Exercise, reduction of salt and alcohol, and stress management are also huge factors in controlling hypertension. These lifestyle changes are something that I believe are essential for health and healthcare, just beyond the topic of hypertension. They will often do more than pills and actually address the root causes of many problems, not just hypertension. Taking control of your health is a big deal, but the benefits are equally big. So I encourage all of you to start taking those small steps to living a healthy life and reaping the benefits. All right, now on to the part of the episode where we talk about the culture behind high blood pressure and health a little bit more generally, and how we can have a bit of a frame shift to look at it from a different light. So to set the stage here, let's review a study that looked at how people with hypertension actually perceive hypertension. Most of the participants knew some factors that contributed to hypertension, but some did not, which seems to indicate that health literacy is a big factor in culture that needs to be focused on. Many also thought that genetics played the major role. More people thought that genetics, as opposed to lifestyle, played a role as to why they had hypertension, and statistically, that's unlikely. Only about 5% have the genetic or disease state predispositions to hypertension. It's mostly lifestyle. And they have a couple quotes pertaining to the participants gave quotes about how they pertain to the adherence of hypertension management practices, and they're rather enlightening. And I think they set the stage here for this discussion. So I'll go through a couple of them here. I do not feel I need to check it. I believe all I need to do is keep taking the pills, and if I keep taking my pills, then my blood pressure should be regulated. I don't follow it to the book. I work on certain things. When I'm hungry, I eat, and it isn't always healthy. I don't shop for special foods or anything. I mean, certain foods that are good for you are potentially higher price than food I might eat every day within my budget. When I'm ready to quit smoking, I'll stop. It doesn't affect me. I'm not coughing. I'm not wheezing. I'm not out of breath. I've been smoking for multiple years, like 2.5 decades, 3 decades. I watch my sodium intake, do a little cardio, try to watch my soda pop intake, cut back on alcohol. I've never done drugs, so I don't have that problem. I'm in a situation and I know what causes my situation, and you either do something about it or you just fall off and die. So these views range from absolute denial to a reasonable sense of self-efficacy, and that last one maybe a bit strong and severe, but it really does cover the whole gamut. And I think this illustrates that hypertension and the discussion around it and treatments have to be very individual, because people have such different views on hypertension, and they come at it from different backgrounds and different beliefs and different experiences. So this is the background that we're working with, and we're going to use it as a broader idea when discussing the cultural mindsets and frame shifts. I've already discussed this episode about how high blood pressure is often something that occurs from lifestyle choices. However, this does only paint part of the picture, a large part, but only part of it. As individuals, we have to be aware of a few things in life, primarily what we can and cannot control. I think one of the biggest issues around hypertension and the discussion around it is the fact that society indeed does make it difficult to manage hypertension. Many of the food options that are cheap and readily available are not particularly healthy and certainly raise blood pressure. This is obviously a big deal for people in lower socioeconomic statuses. Sodium, as mentioned before, is in so much of our foods in such high amounts. Salt is basically the magic bullet that many food manufacturers use to make food taste better. Same deal with sugar, though we haven't really talked about sugar much this episode. Food companies, fast food companies, they put a ton of sodium in a bunch of sugar in their foods, and it makes it very addictive, very tasty, very hyper-palatable. But the other thing you have to consider is that you do actually have a say in the matter here. Society makes it increasingly difficult to eat healthy, indeed, but that does not mean you cannot eat healthy and that you don't have any control. So for this section, I'll identify some of the cultural hurdles that you have to be aware of, as well as what you do no matter what background you're from and how you can navigate it. Often, if you can see a trap, that's the best first step in avoiding it, to quote Frank Herbert, roughly, who wrote Dune. Perhaps the most pressing societal issue regarding high blood pressure is related to the fact that there are disparities between different kinds of people. This is an oft talked about issue, and for instance, lower socioeconomic groups tend to struggle more with health in general for a number of reasons, including limited access to healthcare and healthy food, financial worries, and environmental hazards. This is a big topic, but the factor I think is at the most immediate control is food. One of the most pressing issues with regards to food is fast food, like I've already been mentioned. It has been found that fast food places are in higher density in poorer areas, meaning these kinds of foods are the most available, and especially if you're working multiple jobs, you might not have time to cook, and it's just easier to get fast food, which is very understandable. This availability, along with the very thought-out marketing and a strong way that these companies design these foods to be hyper-palatable, it makes fast food companies a strong external force to contend with, indeed. Fast food, though not ubiquitously bad, is generally not exactly the most healthy option, however, or cheap anymore. I don't know about you guys, but the past few times I've been to a fast food place, I end up spending like $15-20, whereas 10 years ago it would have been like $5. So the financial consideration here, I think, is another good motivating factor. Regardless, though, the convenience and admittedly the addictive taste can make it very difficult to stop going, especially if you eat a large amount of fast food, don't have time to cook, don't necessarily have money to shop for super healthy foods at the store, like you can't make it to Whole Foods or whatever. So in this case, what can be done if you're a lower income person or just someone who finds yourself in this position? And as with things of this nature, it's not exactly easy to change a habit, especially when so many fast food companies make their foods hyper palatable and really capture the people that eat them. But even just making a habit to go to the supermarket more often or learning a few easy recipes can make an impact. Personally, as someone who used to eat out like fast food practically every day, I found money was a big motivator as well. Like I said, $15-20 for a meal. Compare this with cooking a recipe at home where you could easily eat a meal for $5. It might take more time, but you could also think about it in terms of, well, I'll be saving money by not eating out. So if I stay home and cook, I'm actually saving money. So it does help in that regard as well. And especially in lower income groups, money factor seems to be a large one, especially as that quote earlier stated, that they thought that they didn't have the money for healthy foods, that healthy foods were prohibitively expensive. But again, I'm trying to show here that that's not necessarily the case. You can also go to the store, look at food labels if you do shop at the store more as opposed to eating out. You can look at the food labels and compare different foods. And sure, you might not be able to shop at the expensive grocery stores, but even cheaper ones, they'll have options that are healthier, maybe not healthiest, but they'll have healthier options at similar price points. And knowing how to read a nutrition label and think critically and be active about these things, these are the kinds of changes that I think are going to help people in these situations the most. And another reason many people do not know how to control hypertension is just a general lack of health literacy. They don't necessarily know what's healthy. They don't know necessarily what to look for in foods. That said, if you're here, you likely don't struggle with this issue as much. But even if you do, reading up on what constitutes healthy food, again, knowing how to read a nutrition label, these can all be very, very helpful things if you're trying to change the food that you eat. In my opinion, giving people the knowledge of how to take control of their health is worth its weight in gold. So telling people to, I don't know, check out the podcast, or if you know someone who maybe doesn't eat as well, giving them resources, these sort of things I think can be helpful, because at the end of the day, knowledge is power. And if you can spread knowledge, I guess that's my point here, is try to spread knowledge. Don't be too pushy. But what people can do with what people can do with knowledge is near infinite, I think, for individuals. So it's a powerful thing. But this brings me to our next cultural hurdle, and that is drugs. So I've gone over the antihypertensive drugs in this episode, and I think that they do indeed have a place for many people. However, prescribing drugs and fostering a mindset of drugs for being the answer for everything isn't particularly helping the cause. Hypertension has increased in the past couple of years, according to the CDC. And with an issue as pressing as this one, I think we do really need to focus on broader cultural change, as opposed to just more drugs, more prescriptions. Healthcare in this regard has a pretty glaring blind spot. It's very successful in using science and research to find drugs, surgeries, procedures to reverse health problems. Very, very good. However, it misses the fact that actually treating the problem, in a lot of cases, requires something besides drugs. That is lifestyle change. To be clear, I'm not accusing the entire medical system, every doctor, every hospital, but Western medicine is very intent on Western cures to ailments, and rightfully so, Western medicine has done so much in the way of progressing healthcare, cancer research, eradicating smallpox, developing life-saving surgeries, vaccines. Western healthcare is extremely powerful. However, this is just one part of medicine, and the other part involves patients and individuals and working with them to lead healthier lives in the first place so that these problems aren't as big of an issue. And as of today, medicine is faced with a hydra of a culture that seems impossible to tame. However, to what I said earlier, there is much you can do, in my opinion. I really think everyone has a lot of power that they're able to draw on, and if you can learn how to draw on it, and hopefully I'm giving you some tools to learn to draw on it, then there's so much you can do. And even if you don't click with a lot of these tools, finding people or advice or whatever, good people to be around is another big thing that can help you get that power, I think is really important. So try to remember that, if nothing else, is that there's a lot more that you can do than you might give yourself credit for. And I think that goes for everyone. So one final cultural hurdle that I do want to mention is legislation. And there are certain things that I believe could be changed within the legislation that would help matters for hypertension and health. For instance, SNAP EBT or food stamps can be a great resource for many people who struggle to afford food. Earlier, we've talked about financial struggles of eating healthy is a big thing for a lot of people. However, this program attempts to foster health have been a little lacking, in my opinion, as you can use SNAP EBT, food stamps, to buy many, many unhealthy foods. You can buy soda and candy and things that aren't particularly helpful. In a word, you can have SNAP EBT but not eat healthy. It doesn't really encourage it, I suppose, is what I'm saying. Furthermore, with food stamps, you can't buy certain foods or supplements. And I think on the supplements front, many of these can be very helpful for people, like multivitamins. And you can't buy foods that are hot at the point of sale. So if you want to go to the store and get a rotisserie chicken, you can't do that. And rotisserie chickens are extremely, extremely helpful for people who don't have a whole lot of time to cook. Trust me on that one. But I think for EBT, I'm not proposing an exact solution here because I think it's a big problem and something that would have to be worked out with a lot of discussion and conversation. But certain things to encourage health, I think, would improve this program. Limiting certain food items like soda or candy might not be a bad idea. All of this, however, would have to come from legislation. Another legislative issue is that in the United States, particularly, there are certain foods and food additives that are banned in other countries, but not in the United States. Artificial food dye, brominated vegetable oil, titanium dioxide, BHA, all of these are banned in other countries because they've been linked to cancer and hormone dysfunction, but they're still legal in the US and food companies still use them to produce food. And I think legislative changes to limit the danger of additives in food and limit some of these additives would likely be a step in the right direction. I could and probably will go more in depth on this discussion, but for now I'll leave it at that. So that does sound like a lot of bad stuff, a lot of hurdles, a lot of obstacles to overcome, and there are a lot of them, but I think each of you has the capacity to overcome them, and I'll give you a couple of my thoughts on that. So with any problem, identifying its source as well as to admitting the reality of the problem is the first step. And with hypertension, this problem often lies in the choices of food. And given the starting point, I think the best way for many people to exercise their free will in the face of culture is to slowly but surely change their diet. The discussion from earlier on slow changes over time applies here very much. But it is also important to note that not everyone's path will look the same. But there will be one common theme, and that's that you have to identify choice points. So a choice point is the moment in time where you actually have the power to decide between two options. This could literally be when ordering fast food. You could either put in your regular order, or you could change it slightly to be a little healthier. To use another absurd example like the pizzas, instead of ordering 8 cheeseburgers, you could order 7, something like that. That's an extreme example, but I think it illustrates the point. And developing this awareness of these choice points over time can be very beneficial. If you can identify moments where you can make a different choice and actually make a difference in your life, I think it can be a lot easier to make that choice. The awareness of those moments can be the first step in real lasting, sustainable change. Another thing I think everyone can do is learn. Like I said before, health literacy is one of the major issues in America. So you can listen to this podcast, others like it, read books, read articles. All of these things will put you in a much better position to understand how to be healthy and how to make those changes. I think having knowledge of a problem and knowing that the problem is there and knowing where the problem is, these are all pretty ubiquitous first steps in solving the problem. And then along with that, one of my philosophies is that effortful movements in the right direction are crucial to focus on. As humans, we really only have a few basic things we can do. We can move towards, we can move away, or we can stay put. And very often I use this frame to consider how I want my actions to look. If I know I should do something, sometimes all I have to do is make a tiny movement towards it. For instance, if I want to go to the gym, but I'm lying in bed, I'm not really feeling up to it, I'm kind of tired, I'll just tell myself, hey, just step out of bed. Just take a step out of bed, get up. And that's the choice point right there, first of all. And it's also a very, 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 very small movement that I can take that's in the right direction. Back to that 1% moving towards the goal from earlier. And conversely, if I see a fast food place, for instance, and want to stop for some because I'm hungry, I'll tell myself, well, just don't put on the blinker. Just don't get over in the other lane to get off on the exit and go to the fast food place. Just wait until you get home. And if I can just focus on not putting on the blinker, this is often enough to stop me. My point is, you don't always need to think of the broader action as something to overcome. You can just choose a very, very small action in the sequence of actions that get you there. Instead of going to the gym and thinking, I have to go to the gym and lift heavy weights and be there for an hour, just think, okay, what's the first step in that process? And often it's get out of bed or take a step towards the gym. And these first steps of the process are so much infinitely easier than thinking of, I have to do this big thing. Just think, I have to do this little thing that is one piece of the big thing. I hope that makes sense, because I think this idea is really valuable, and it's certainly helped me a lot. And using these micro movements to, at the very least, orient yourself in the right direction, and at best, doing the actual thing you wanted to do, is a very powerful tool. But perhaps none of what I said today clicked with you. Perhaps these hurdles are just too big and you're still overwhelmed by them and you still don't know what to do. And to be honest, that is okay. Listen to other people, hear different points of view. I think that's important. I've listened to many people, I've read many books, and not all of them have clicked with me. Some of them have. And you have to find out what works for you, discern the wheat from the chaff, so to speak. And, maybe I didn't have what you wanted, but maybe someone else has the magic sauce that sticks, and maybe listening to this was the first step in getting you there. And at the end of the day, what's most important as well, there's a lot of important things, but this one is rather important to focus on, is keep pushing, keep trying. Even if you fall or fail, it's so crucial that you get back up. It's so easy to start on a path. You want to lower your blood pressure. This is the time I'm going to start doing it. You start getting your diet in order, and then boom, you stop at Taco Bell and you have a couple burritos and you're like, that's it. I can't do this anymore. I failed. I dropped the ball. I am just not cut out for it. These sort of things happen to everyone. Everyone reaches these setbacks. Everyone has to contend with them. And it's hard to overcome them, but you have to be kind to yourself. You have to be fair to yourself. Think of if someone else did that. If one of your friends or your partner or your parent was on some path and they stumbled and you're like, oh, well, I guess that's it. I guess you can't do it. That you're a failure. It's like, no, you wouldn't do that. You'd be like, well, you stumbled this one time, but think of all the other stuff you've achieved. Like, this is just one roadblock, and you can bounce back from it so quick. And having that sort of compassion with yourself is super important here. So don't be too hard on yourself. Keep trying, keep pushing, stay diligent. And I think over time, with this sort of mindset, you can see a lot of benefits and a lot of improvement. You're not your failures. And don't let your failures discourage you and make you think that you're not enough or that you're not up for the battle, because you are. So I guess my main point with this discussion is that yes, overcoming hypertension is difficult. It's hard. There's a lot of things in your way. But these barriers by no means indicate that you can't do it. There's a lot of strength in every human, I believe. And finding this strength, however you find it, and taking the first steps one at a time, being persistent and reflecting on what you can in fact do, will get you there. Today we talked about hypertension, high blood pressure. We talked about how the medications that treat it work, as well as the best lifestyle changes to manage high blood pressure. We also took a step back, looked at culture and society, as well as a frame shift on perhaps how to think differently about changing these things. Though the picture may be bleak, the individual power that all of you have is so strong and so powerful. No matter if you are currently struggling with hypertension or just want to learn about it, I wish all of you the best and hope you learned something today, or that this podcast helped you in some way. Make sure to subscribe and follow and share this with your friends and family or people you think it might be beneficial for. And I appreciate you for listening. Can't wait to see you all next time. Have a good one.